Thank you, Rebecca, and good morning, everyone. At the Department of Health, we thrive on providing South Dakotans and the media the most up-to-date COVID-19 information as it becomes available. And to that end, here are the latest statewide COVID-19 numbers. New confirmed cases, 131. New probable cases, 50. Active infections, 1,993. Recovered cases, 108,947. Currently hospitalized, 97. Total tests performed, 979,828. To a total unique persons tested, 424,345, yielding 112,833 positive cases and 311,512 negative persons.
We want people to go.
We continue using the RT-PCR positivity rates since that measure is being used by the CDC as well as CMS for nursing home and long-term care facility reopening plans. That last 70 number as of this morning is 8.3%. Additionally, 229,762 doses have been administered to 150,076 state residents. This provisional data can be found on our updated COVID-19 dashboard, which is located at doh.sd.gov. As a reminder, for the month of March onwards, we will be having our briefings every other week. After this presser, the next press brief will be March 17th and March 31st. As always, we're always here to answer your questions as needed. Before I turn it over to our state epidemiologist, Dr. Joshua Clayton, let me just please remind everyone to mute their phones.
On your end.
Dr. Clayton.
All right. Thank you, Daniel, for those updated COVID-19 numbers. And let me just start off by reminding everybody that, when we're talking about vaccination, everyone should get the vaccine that is first available to them. Really, we're looking at not having any sort of preference around the different vaccine now that we're adding the Janssen vaccine to previously FDA EUA approved Pfizer and Moderna vaccines. So very exciting as we're starting to get those vaccines in the state. So as far as our COVID-19 cases, hospitalizations, and deaths, we have remained approximately steady over the past week. This does mean that we're adding about 150 new cases per day, about 9 new hospitalizations, and about 2 deaths per day. When it comes to the outlook that we have for variants and the continued surveillance efforts there, it is noteworthy that we have seen the B.1.1.7 variant identified in all of our surrounding states, with the exception of Montana. And that total surveillance for that variant has identified 2,506 cases in 46 jurisdictions. For the P1 variant, the only surrounding state where that has been identified is in Minnesota, and there have been a total of 10 cases nationally across 5 jurisdictions. And for the B.1.351 variant, it has not been found in any of the surrounding states, but we have seen 65 total cases across 17 jurisdictions. And so to date, none of those variants have been identified in the state of South Dakota. The last thing I'll leave you with is just, kind of a continuation of an article that CDC had released a couple weeks ago now, which was looking at the vaccine adverse events that have been reported over about the first month of the Pfizer and Moderna vaccine being available. And we have seen to date about 79 million doses of vaccine being administered in the U.S. and approximately 225,000 doses administered to about 150,000 people in South Dakota. There is no definitive evidence of deaths being causally related to vaccination, and what we typically do see are local and systemic reactions, and that particularly for local reaction involves pain at the injection site, and for those systemic reactions involves fatigue, headache, muscle pain, and chills. Now, the symptoms duration for those local and systemic reactions is typically 1 to 2 days, and that is shortly after that first and second dose of vaccine. We do ask that any citizen, medical provider, or public health worker that has a adverse event reported to them, continue that reporting and submit that to the VAERS staff, the Vaccine Adverse Event Reporting System staff at HHS. And you can do so by logging on to the website VAERS, VAERS.hhs.gov, and submit your adverse event following your vaccination. So with that, I will now turn it over to the Secretary of Health, Kim Malcolm-Ryerson.
Thank you, Dr. Clayton and Daniel. Good morning to everybody who's joining. I'd like to touch on several topics and then open up for questions. Relative to our vaccination efforts in South Dakota, since over a week ago, over 229,000 South Dakotans have received a vaccine, and that's up from 186,000 people in just a week. We have almost 80,000 residents who have completed their full 2-dose vaccination, which again is really a leap in getting back to normal. South Dakota's resumed. I'm sorry, we're having some feedback here. Let me make sure folks have muted lines. All righty, we'll go ahead. As of now, our application for next week stands at 18,830 doses, and that's broken down between both Pfizer and Moderna. We are anxiously awaiting information about the Johnson & Johnson vaccine that will become available.
The leader has muted your line. To unmute your line, press #6.
It's also important, though, to remember that this allocation at the state level does not include the supply that's being distributed by the federal government to entities such as the Veterans Administration, Indian Health Service, and the Federal Retail Pharmacy Program. So regarding the Federal Retail Program, immediately following this briefing, everybody who's registered will get a press release with detailed information on the participating locations. We've seen a big uptick in the number of places that South Dakotans can receive COVID-19 vaccination, again, according to the state plan, and in several communities across the state. I just want to also mention that the issue with, coverage across the state has improved as well. Walmart in Rapid City will come online tomorrow, which will be one of several West River pharmacies that will be having vaccine available. All told, we have 56 different locations of community pharmacies that will be getting vaccines, so we're very pleased by that. We urge anybody that is seeking to be vaccinated to check our website for more information. That's constantly being updated, including maps for where the nearest participating retailer might be. The other update I wanted to provide is that because we are seeing increased access points and increased vaccine supply in the state, we are now moving to vaccinate those individuals with one or more underlying conditions. And so we talked last week that we were making a change in our priority populations from 2 or more underlying health conditions to just the 1 or more underlying health condition. You can see more detail about those particular conditions on our website, so please do go out and look at that to see the conditions that qualify, and that's based on CDC guidance. As a note, we will continue vaccinating all individuals 65 and older and anybody else that has qualified up to this point who hasn't been vaccinated. So we really want to see everybody who's eligible to sign up and get their shots. To do that, South Dakotans can go on to the covid.sd.gov website, and from there they can register with their assigned county system. They can also, again, find that map of participating retail locations. My last reminder, vaccination is that individuals who are qualifying for vaccination based on age or by having one of those underlying health conditions must be South Dakota residents to get the shot in South Dakota. The other very quick update I wanted to provide folks is that we continue to encourage residents to be tested for COVID-19. We are not out of the woods yet, and if folks have symptoms, if they have been exposed to a positive case, or they may have been exposed to a positive case, we're really encouraging people to be tested. There's a free at-home COVID-19 saliva test available. All South Dakota residents can visit our website and from there get linked with that testing option. The Vault company will send that kit to your house with instructions on how to collect the specimen and send it back. It's no cost to the person who is getting tested. So thank you for helping us get the word out about that. With that, I think we'll turn it over for questions.
Okay. Thank you, Madam Secretary, Dr. Clayton, and Daniel. At this time, we will open the floor for questions and answers. If you'll please identify yourself, your media outlet, and ask your question. Who would like to go first?
Todd Epp, Kello.com News.
Go ahead.
Thanks. This question might be a year too late, but it's been rolling around in my head. Did we flatten the curve? Do we still need to worry about flattening the curve? And was that ever really a possibility that we were indeed going to overrun our healthcare facilities?
Well, Todd, this is Secretary Malcolm-Rice, and I'll start and then look to Dr. Clayton to add information as well. I do think we flattened the curve, and thankfully did not see, the 5,000 hospitalizations, let alone the 10,000 hospitalizations that we were, that was being projected in the early days. And so, we did see our peak in mid-November, and I can tell you that even when we were having days of 600 plus people in the hospital on a given day, that it was very, very stressful and very impactful on our hospital system. So having gone through that period, all I can say is thankfully we did not rise higher than those levels that we saw, because it really was putting strain on our hospital system.
And this is Dr. Clayton. I would just, want to emphasize that, all of the precautions that people take, whether, simply washing your hands, adding in, avoiding crowds and staying away from people, adding in wearing of a face mask, all of those have that additive effect to increase the prevention of COVID-19. And so, if we had people who, in a mixed population, you're going to have some people that don't, have a large number of people that do, and that the number of people that are taking precautions, even the simple ones, really do help decrease risk of transmission of COVID-19, and then subsequently the populations that are most at risk for hospitalization and death. So I would say that, yes, definitely that there have been impacts overall to our COVID-19 cases and hospitalizations and deaths by actions that have been taken to prevent illness. And I would say, we have another tool in the toolbox. Vaccination has been available in the state starting with some of our most at-risk populations, including healthcare workers caring for individuals with COVID-19 infection, those in long-term care facilities. As we know, folks 68 years of age and older make up a vast majority of our hospitalizations and deaths, and that as we continue to provide vaccinations out further and further into the community, that does not lessen the need for additional prevention strategies that we have taken, since day one when COVID-19 first came to South Dakota.
Okay.
And one quick follow-up. Governor Noem was very prominent this weekend on national news and in Florida, elsewhere, about South Dakota being successful in its kind of hands-off approach to the coronavirus. Since you folks deal with the numbers and the science, do you think South Dakota's approach to handling this, now that we're a year in, has been successful, unsuccessful, moderately successful? Where would you peg how we've done as a state in handling the coronavirus and with the various numbers that we report every single day?
Well, Todd, this is Secretary Malcolm-Rice, and I think we feel like we have had a successful response to COVID-19. That's because of the work of many, many people, including everyday South Dakotans, who took this seriously and did what they could do to reduce the spread of COVID in our state while still being reasonable and living their lives. And I think it's important that we keep sight of the entire picture. We know that people need to keep working. They need to keep supporting their families. We've done great with keeping kids in school so that they can continue to learn and not get behind, which can set people back, years and years and years from an income standpoint and otherwise. And so I think you've got to look at a state's response in its totality, and certainly case counts are certainly a part of that. But we are, we're excited about where we're at right now. We are leading the nation as it pertains to vaccination. People are stepping up to become vaccinated, and that's going to really help us see the end of this pandemic, and we're excited for that.
Next question, please.
Thank you.
This is Jonathan from the Argus Leader.
Go ahead, Jonathan.
Thank you. Hey, a couple quick things. Could you repeat again the vaccine allocation in the Johnson & Johnson? There was some feedback going on. Didn't get those numbers. And then secondly, the CDC is reporting a much higher level of vaccination than our dashboard is with regard to the state and federal allocation, and I'm kind of wondering which one would be more accurate to, which is a better representative, I guess.
Well, I'd like to say the higher number is always going to be better, but I'll defer to Josh on that. Jonathan, the allocation for next week at this point is 18,830 doses. That does not include the Johnson & Johnson. We're waiting for final confirmation of that number. We have been told to expect 7,000 doses, but again, we're not counting that until it's actually finalized in the system in terms of our allocation.
And as far as some of the numbers differences that you'll see between, say, the CDC COVID tracker and what we're representing on the website. So the vast majority of the information in the vaccine tab is specific to the allocation that we've received as the Department of Health. We do have now added in, as of last week, the percentage of the population that has at least one dose of vaccine, which currently today stands at 26%, which is a little bit lower. CDC is actually have two different denominator populations. Because Pfizer vaccine is eligible to those who are 16 and 17 years of age, we've included that population in our denominator and not gone the route of looking at total population or populations 18 years of age and older. And so you will see some differences in relation to the numbers that we're using in order to calculate the vaccination coverage.
Okay, and can I ask just a quick follow-up on vaccines? You emphasized, Secretary, that this is available to only South Dakota residents. Are you seeing residents of other states trying to get vaccines here?
Yes, we've seen, as our systems have opened up their, online reservation systems, we've seen, lots of folks from neighboring states in particular, trying to sign up, and of course, we lead those out. We're also aware of groups in other states. There's a particular Facebook group in Minnesota that has been advocating people come here to be vaccinated, which I think speaks to the success that we've had in terms of getting shots in arms. But again, the state allocation of vaccine is intended for South Dakota residents.
Okay. Next question, please.
Eric Merrick, LN News.
Go ahead.
Yeah, probably for Dr. Clayton. Dr. Basil with Avera has said epidemics, pandemics typically come in three waves. But looking in South Dakota with vaccinations increasing, is it safe to say we won't see anything like the mid-November peak, or rather, what would a possible third or next wave look like?
Yeah, and that's a really good question, because it does raise the perspective of projections down in the future and stuff like that. And what I can say is that every day that we go and get more shots in arms, the less impact that we will see from any potential future increase in cases. Now, obviously, we have some of the threats to that are really focused around variants. And if we have a variant that virus that comes into the state and is not covered by the vaccine, as we've seen with the B1.351 having reduced effectiveness, and a little bit on the P1 variant as well. That would be a possible reason to kind of, we might see additional cases into future increases of COVID-19 within the state. But, really the big perspective that we have is the more shots in arms that we have, the lower the impact, any future impact to increased COVID-19 cases we will see.
Next question, please.
Jeremy Fugelberg, Forum News Service.
Go ahead, Jeremy.
Yeah, so we've got reports, a number of reports from people who say they don't believe they actually qualify for the vaccine at this point. These are health system workers, specifically for Sanford, who don't have underlying condition. They're younger than 65. They're back office type employees, IT, HR, stuff like that. Apparently, they are getting vaccinated as of today. Can you help me understand why those people might be up for vaccines now?
Jeremy, I can't speak to that particular situation, and so we would want to do a little bit more, information gathering before giving you a response on that.
Okay, thanks.
Next question, please. Hearing none, we would like to
Ray from Kellerland.
Go ahead, Ray.
Oh, thank you. Hey, what's the reaction to President Biden's announcement about 300 million vaccines by the end of May, and how can you start to even prepare for that?
Well, Ray, we're excited. We've been, waiting for more allocation in the state, for some time now, and we are ready to, get shots into arms. Of course, we've heard projections before in the past, and, we will be in a wait-and-see approach until we actually see the numbers showing up in the federal system that says we're sending this amount of vaccine to South Dakota to get shots in arms. But, I think South Dakotans are ready. We've seen that so far. Our vaccinating partners are ready, and I'm optimistic that if we do get more allocation, we'll be successful with those.
Could this be where we would start seeing the mass vaccination clinics that maybe had been just mentioned before?
Yeah, absolutely. I mean, our ability to run mass vaccination clinics depends on our allocations, and with more allocation, that just makes that more feasible. I also do think that, increasing the access points across our state, such as with the federal retail pharmacies, is also another really important component, because that helps people just access health care like they, would more typically access for other kinds of vaccinations, flu shots, that kind of thing. So I think we've got a lot of promising things in the works that will really help us get over that hump.
Okay.
Thank you.
Chris Dancy, News Center 1.
Go ahead, Chris.
Dr. Clayton, early on in the vaccination process, one of the open questions was whether or not a fully vaccinated person was merely protected from getting the disease, or whether or not it also prevented them from carrying a viral load. Do we have any further information yet on whether or not a fully vaccinated person might also still be contagious?
So I would say that is still an area that is being evaluated by vaccine manufacturers and by CDC. We don't have any additional information today compared to where we were when the first vaccine was licensed. And so that is why there are still some precautions for requested of individuals who are fully vaccinated, and why it's also important to continue to maintain other prevention measures that we've espoused before on calls to prevent COVID-19 transmission.
So just to be explicit about it, then the health department's recommendation to fully vaccinated people is to continue all of the precautions, masking, social distancing, that sort of thing.
That is correct. The individuals who are fully vaccinated, still have the theoretical risk of transmitting COVID-19 until such time as we have additional data to prove that those individuals are not able to transmit the virus. And so, really the mitigation through using precautions is the key factor for everyone, regardless of vaccination status.
Okay, thank you.
Mm-hmm.
Any other questions?
Jeremy Silverhart, Board News Service.
Go ahead.
Hey, yeah, I'd gotten a question from a parent, I guess in this case, who was wondering if there was any plan to vaccinate kids like under age 18 and down, and when that would take place.
So I know that there are some studies that are going on now, specifically looking at children to make sure that the vaccine is effective for that population. We don't have any specific estimates of when that information will be available. I'm hopeful that before the close of this year that we'll have enough guidance from CDC to be able to start vaccinating into that population, but it may be into the new year as well, depending on how long those studies are going on.
So right now, Jeremy, the Pfizer vaccine is the only one that's approved for people 16 and 17. Otherwise, the other two vaccines are approved for people 18 and plus.
Okay, thank you.
We would like to thank you for participating in today's conference call.